All right, where we are going to get started. Good afternoon, everyone, and welcome to our webinar. Thank you for joining us today. We are just very excited that you're here. We've had over 220 registrants today, so I know we're going to have a wonderful chat. My name is Karma, and I will be moderating today's conversation. Before we get started, we have a few housekeeping notes. So this webinar is being recorded, and we will send the recording and an evaluation link if you're interested in receiving social work CEUs after the webinar. Make sure if you have any questions, you can submit them in the question and answer chat box. We'll save time at the end to lift questions for our panelists. And if you have any tech issues, again, you can use the question and answer chat box. Someone from our team will be able to assist you. So we're just really excited to be in community with you all today and to share space for conversation around youth, safety, and secure firearm storage. Okay. So to start, you're going to hear very, very briefly from each of our hosts, from myself and two of my colleagues. We're going to share an overview of our programs and let you guys kind of know how this work connects to our conversation on youth safety and prevention.
Put your forearms in.
All right. So again, as I mentioned, I am Karma. I'm with Strengthening Chicago's Youth with Lurie's Children's Hospital of Chicago. And our mission is to connect and mobilize around public health approaches to violence prevention. Our strategies include policy and advocacy, innovative programs, and sharing what works, which is why we are here today in community. I manage our secure firearm storage program. And so through tabling events, virtual trainings, webinars, in-person workshops, we deliver education on secure firearm storage practices and firearm restraining orders. We also distribute firearm locks and firearm lock boxes to whoever needs them. And a quick recap of 2025 for our secure storage program. We held over 10 virtual trainings, reaching over 600 individuals, which are parents, providers, caregivers. We had over 19 in-person sessions, reaching about 300 individuals. And this was with hands-on demonstration and resources. And we had about 26 community events. So we are in the communities, all 77 communities of Chicago's, especially in communities most affected by gun violence. And lastly, this is just to measure knowledge and behavior change from our secure storage trainings. 96% shared that they felt their knowledge has increased around firearm safety with children. And you see 90% feel that they're more likely to have these firearm safety conversations with children. And about half individuals felt that they were confident in their ability to store firearms properly. And this is from 155 individuals that completed our survey last year.
Awesome. Thank you, Karma, for sharing. My name is Kalita Armstrong, and I am on the End Family Fire team at Brady United. You may know Brady from like the Brady background check and from some of the work that we do in changing the laws around the country around firearms and firearm purchases and such. But I specifically work on our culture change program, which really puts at the heart of the work that we do that guns are going to exist in this country. And so how do we have more conversations about what secure storage is and how we can each practice it if we are gun owners or those who live in gun owning households? So just a really quick background. I won't do too much on this slide. I know there's a lot of words, but essentially our work brings gun owners into the conversation to make them a part of the solution, right? So our work does our best to not talk at gun owners, but to really have them having a seat at the table with us to talk about, what is the kind of messaging that would have you change how you store your firearms, or what's the kind of messaging that would have you have better conversations about what secure storage means and how those within your community can also practice it. Our work is nonpartisan and non-advocacy and apolitical, because our singular call to action is just for those who own firearms to take one more step to store their firearms more securely than they already do, right? So when we talk about this, what we're saying is like if you already have a trigger lock on your firearm and it's in your bedside table, can you remove the ammo along with having the trigger lock, right? Or if, it's in a biometric safe, can you have it be in a biometric safe and then also remove the ammo and store that somewhere else? In general, our goal is just to make sure that those who are not supposed to have access to firearms do not. So and then just quickly here, most of the work that we do is in media and marketing. So, PSAs, billboards, bus shelters, newspapers, all that kind of stuff. And what we found is that when people know more about this messaging, they are more likely to do a thing, right? And that's true in education in general, right? The more you know about a thing, the more likely you are to do a thing. And so for us, awareness at the moment is at 64%, meaning that gun owners across the country are 64% aware of our PSAs and have seen them and have interacted with them in some sort of way. That we've got like 38% when they have seen one of our PSAs that they're also seeking out additional information about how to securely store their firearms. That again, more likely to talk to their family and their friends about what secure storage means. And then, of course, they agree that having their guns locked and unloaded reduces the risk of someone in their home dying by suicide and other tragedies as well. So all of this is to say that End Family Fire has been working very closely with a lot of Illinois-based grassroots, local governments, all the organizations literally to, really ensure that our messaging layers well with the work that they're doing on the ground.
Hi, everyone. I'm Emily from the Illinois Public Health Association. I apologize that my video feed is not working today. We created media campaigns, both for social media, for other types of media, for toolkit downloads, flyer downloads. So we have here opinions versus facts. There's nothing you can do if someone is thinking about suicide. A fact, simple actions like safe storage or temporarily removing firearms can create time for space and support. Opinion, hiding a gun is good enough. Fact, kids often find hidden things. I'm sure we all have a child, niece, nephew, cousin who's found something around our house that we wish they did not find or that we are embarrassed that they found. Our approach to outreach and education is to use community health workers as a deployment strategy and intervention. So we have community health workers at local health departments, at community-based organizations, and we advocate for a clinical community linkage tag team approach, where a community health worker at a community-based organization tag teams with a community health worker at a local health department or at a medical center or a hospital so that they can provide the education to the same patient and linkages to mental health care or other care that's needed. We have CHWs that are inside the brick and mortar. So that is those that are stationed within a food pantry, for example, or stationed within the local health department. But we also have CHWs that are in the field, and we advocate and push for that out of the box approach. So we don't want you to just sit at a desk at your local health department or sit at a desk in the food pantry. We want you to go out to the community, meet people, learn people, engage with people. And we find that awareness, education, firearm safety, and referrals, and that cross-agency or that tag team approach can equip community members with the tools to intervene early and potentially save lives. These are two products that we were giving away to community members who need to store their firearms. Community health workers did what I described, went out to the community, met people, brought them back to those brick and mortar locations. We have the rifle safe on the left, and we have the pistol lockbox on the right. And then we also have the cable locks at the bottom. Youth engagement, necessary outreach strategies. So when we outreach not only with youth, but also their caregivers, we want to meet them where they are. That could be the stage that they are in terms of their mental or physical health, their behaviors, their thoughts, their opinions, or that could be physical. So meeting them at the patient hospital room, meeting them at the local health department clinic, meeting them at the community center. Trust building, cultural humility, and lingo literacy is especially important with preteens and teens. And I just learned today, even adults. Karma and Kalita referenced something earlier that I had no idea what that means. We are a few years apart, and even just a couple years apart can affect that lingo literacy. Here's a story from one CHW. They point out that interaction and that interpersonal engagement, that person-centeredness helps gather that personal history, that personal interaction. It helps them understand the youth's situation. This community health worker was from the Community Wellness Project in East St. Louis. This is an area that is very impoverished. There's a lot of community violence going on. There's a lot of domestic violence, interpersonal violence. He reported that he was using a firearm to protect his younger siblings, and that he was scared that something would happen to him and his younger siblings. But he also expressed to the community health worker through trust building that he just needed somebody to talk to. He just wanted somebody there to hear his story. And the lingo references are, we just started chopping it up. This is an old term, but it's also a cultural term and a young term as well. And as we may have heard lately, using the word bet. So after he received his gun lock and decided to use it, he said, "Hey man, bet." For those of us not familiar with that word, it comes from the term like "you betcha" or "I gotcha."
Awesome. Thanks, Emily. And thanks, Kalita. Thank you all for that grounding context. And with that foundation, we'll move into our panel discussion. So, as I mentioned earlier, you all, my name is Karma, and I will be serving as today's moderator. I'm just extremely excited to guide this conversation and uplift the perspectives of our panelists. So, I'll introduce our panelists, and I'll ask each of you to give a brief wave when I call your name. Our first panelist, we have Dr. Sama Kamal. She is a medical doctor. She is an attending physician in pediatric emergency medicine at our hospital, Ann and Robert H. Lurie Children's Hospital of Chicago. We also have Olivia Brown. She is the Associate Director of Youth Engagement at Project Unloaded. We also have Rachel Jacoby. She's a firearm risk reduction coordinator at the Lake County State Attorney's Office. We also have Almira Khan. She is a violence recovery specialist social worker at the University of Chicago Medicine. We also have Antaeus Simmons. He is the president of Under the Helmet Riders Organization. We have Monique Williams. She is an Illinois coordinator for the Supportive Housing Association. And then we have our two youth panelists, Lexi Castillo Rodriguez. She is a Brady youth advocate. And we also have Junia Lee. She's a March for Our Lives Palatine co-lead. And again, those are both of our youth representatives. Okay. All right. So for each question, panelists, you'll have about 2 minutes to respond so that we can hear a wide range of perspectives. And I will give you all a
I'm
very
in the training.
I'll give you all a very gentle time cue just to make sure that we all stay on track, okay? All right, so let's get into it, everyone. So, to ground us, I want us to start by centering youth, right? So, the first question is, how do youth and youth culture influence the way that you think about safety in your everyday role? And we're going to hear from, in order, Dr. Sama, Olivia, Rachel, Almira, Antaeus, Monique, Lexi, and Junia. Okay, so Dr. Sama, whenever you're ready.
Yes. Hi, everybody. Good afternoon. It's great to be in community with you all today. So, Karma mentioned I'm an emergency medicine physician, and I think about youth safety quite a bit, and how youth culture impacts that. There are many times where it's very obvious that youth safety is part of my interaction. For example, someone that comes in having been assaulted, someone coming in having suicidal thoughts. And then there are times where it's less obvious and you really just have to dig into what it is that brought someone there. Maybe they came in with belly pain, but you find out by spending just a little bit more time with them that there are certain things happening in their life, in their community, that is leading to more somatic symptoms. And so I think about youth safety a lot. We're going to talk about gun violence a lot today. It's the number one cause of death for children. I think there's a lot that happens before that moment, and opportunities to intervene. And that is something I think about professionally and personally, as a member of this community. And so I'm grateful to be talking about it more today.
I'll hop in from there. Hi, everybody. Excited to be here with you all. Youth culture and influence is at the center of everything that we do at Project Unloaded. So our work is twofold. We create large-scale digital and cultural campaigns and work locally in communities around the country, spreading a message that guns make us less safe to young people, primarily age 13 to 17 years old. So when we think about how we spread that message and how we show up in communities, we're looking to the young people in our network to be leaders and influencers, both like in their communities, but also in a digital sense, because influencer means something specific on the internet, and that's how we are meeting them intentionally. So we know that a lot of young people online want to have a conversation about guns, want to learn risk and facts about how guns are showing up and influencing their own lives. And we're giving them the opportunity to use their culture, use all of the brilliance that they have and all of the expertise that they have as young people who know about what it means to be a young person living in this time, and giving them the space to have a conversation with each other. So youth and youth safety is really central to everything that we do. One of the things that we also share to our young people and around all of our campaigns, that gun violence is a leading cause of death for kids and teens in America. And we take that fact and give young people an opportunity to be change makers in the solution to violence.
Hi, everyone. I can go next. Thank you all for being here today, and really grateful to my fellow co-panelists and the organizers just to be able to participate in this conversation. Um, so I work in a local office of gun violence prevention up in Lake County, Illinois. So the biggest city in our region is Waukegan, for those who may have heard about it. And when we're thinking about youth and the topics of secure firearm storage and gun violence, we're always really hyper focused on reducing barriers to access and thinking about how we can put the burden on ourselves as a local government entity to meet people where they're at and remove any potential barriers to access to resources, information, and anything that any sort of support that folks need. So when we're thinking about youth in particular, we rely a lot on our community partners, on partnering with educators in local school districts in the area and kind of building that trust with youth. And then we also try to be really intentional about engaging youth and thinking about how we can center youth voices and not kind of prescribing what we think is important to youth or what we think young people should be focused on or doing, but trying to hear directly from them and letting their perspectives, their lived experiences influence the way that we shape our programs.
Hi, I think I'm next. I'm Almira. I work at U Chicago Medicine as a violence recovery specialist. So we see a range of people, including youth, that are impacted by community violence. And so I think the way that we think of safety sometimes is like, oh, this is a tragedy, obviously. And at the same time, you hear comments of like, oh, they're doing something they're not supposed to be doing. And so a lot of times the onus is put on youth versus actually like understanding what got them into that situation in the first place and what the root of the problem is. And so what we do is we have a violence recovery specialist that is dedicated to pediatric patients, and they are speaking and connecting with our youth while they're in the hospital, and also connecting with families as well while they're there, to try and understand like what's going on, what led to this situation, and what kind of access do they have to firearms. Um, and then, so that's for community violence. We're also there right when they enter for any accidental shootings as well. In the cases of, finding mom or dad or, guardians, firearm somewhere and accidentally shooting themselves, in the unfortunate case. And so, in that sense, it's also thinking about like what kind of access does the family have to safely storing their firearm, and like what were the circumstances. Obviously, in a hospital, we're dealing with ourselves as well as social workers, so they're also kind of investigating that whole situation as well. But I think
Thanks, Almira. We're going to transition to Antaeus. Thank you.
Hi, I'm Antaeus, and I'm the president and founder of Under the Helmet Foundation. We view cultural safety as very important. We understand that cultural safety is not just in the area, but also a social digital world. So we try to attack that as well. We also work with individuals who just be out of a gang. One of our people just told us and gave us a great saying is, "The streets made me who I am, but it destroyed everything I could have been." And that's something we try to tackle when it comes to youth safety. When it comes to safe storage with firearm safety, we also teach those individuals how to perform CPR and stop the bleed. Because understanding we can't always prevent it, but if we can teach them how to save a life just in case that emergency discharge happens, that's what our organization likes to do.
Monique, whenever you're ready.
Oh, I'm sorry. I thought I had more folks in front of me. I apologize. My name is Monique Williams. I'm the Illinois coordinator for the Supportive Housing Providers Association and the Training and Technical Assistance Manager. And so my job is to teach standards and best practices, evidence-based practices as it relates to client-centered service delivery, trauma-informed care, motivational interviewing, and such. Um, the youth are near and dear to my heart because I coached speech and drama in high school for about 20 years. And so I've always had like a soft spot in my heart for the youth. So I mentor a lot of youth. I've raised many children in this community. And so I know that youth culture is kind of, for me, driven by authenticity. Um, they value realness and they know and can tell when you're not being real. So that authenticity is how you um, build rich relationships with them, where they know that they aren't in a space where they'll be taken advantage of or exploited or manipulated in any kind of way.
Thank you
Um,
so much, Monique. We're going
sorry.
to transition. You're fine. We're going to transition to our youth. Lexi, whenever you're ready.
Hi, everyone. Thank you so much for attending this webinar. and to be in community, especially after this past week with everything kind of coming out with kind of the current state of our political and social climate. And I think as the youth culture kind of influences this type of information when it comes to safety, I think it's super important to acknowledge that we are very influenced by our peers, especially from very young ages. And so I think living in the day and age where you have so much access to information, but we actually have a lack of education for these topics. And I think especially when it comes to safety and gun violence specifically, a lot of people just don't understand what it encompasses. And so what we really try to do with Brady and our youth-led organization Team Enough is to really hone in into making people understand that gun violence is also the epitome of suicide, has to do with accidental shootings, has to do with not just mass shootings. And so we really want to influence our youth to have conversations with each other, especially as we get into a lot of videos being uncensored and a lot of the youth kind of trying to critique and trying to really yearn for safety in our communities because they're the ones who are being the most affected.
I think I'm next. Hi, everybody. My name is Junia. I'm so excited to be here with you guys today. I'm a high school senior from the Chicagoland area. So a lot of my work centers around being able to involve my peers and other young people in gun violence prevention and conversations around gun safety. So in my opinion, youth culture is something that is highly shaped by like emotional safety, like peer dynamics and online environments, as Lexi just mentioned. And I'd like to talk a little bit more about like emotional safety. So feeling heard, respected, not feeling singled out is often just as important as feeling physically safe. So when in dialogues with other young people, being able to make sure that they are being wholly seen and heard is so important to me. And also in relation to peer dynamics, young people are constantly navigating with different group belongings and a pressure to conform so often. Being able to like rely on like a friend or bringing someone that you trust to conversations like these can be so important to shaping investment and creating safer environments. And lastly, I just like to say that when young people are being trusted to be partners in conversations like these, rather than being treated as like passive recipients of this kind of like policy of safety and culture, they feel so much more connected and valued. So thank you so much for having me here today. And yeah.
Thank you all for such insightful comments, especially based on your everyday roles and what you see in community. I do want to acknowledge to our attendees that this is a heavy topic. So if you do feel you need any type of support, please, you can reach out to Emily privately. We can direct you to resources, or if you do feel you need to exit and regroup, we encourage you to do so. So this next question is about community. So how does gun violence impact your profession, community, or your day-to-day life? I'm going to start with Dr. Sama, followed by Olivia, and then we'll close with Rachel.
Thanks, Karma. And you are going to have to cut me off because I could talk about this particular question all day. I'm an emergency medicine physician. I obviously see gun violence in my professional role. Those are some of the hardest days that I've had in my job as a pediatric emergency physician. I shouldn't be seeing kids shot. I shouldn't be seeing kids killed, but I do. And that is just the tip of the iceberg, right? Because there are also kids downstream from that who are affected by their friends, their peers, their community members who are shot. And they come in with things related to that as well: mental health, physical health, social needs. And then there is just the community in general. I am grateful to live in Humboldt Park in Chicago, which is a beautiful community that is also very impacted by gun violence. I live on a block where I personally hear gunshots. And I have my own child. And so I think about this as a physician. I think about it as a mom. I think about it as a member of a community. And it is a problem that is constant and insidious, and one that people are very energized to solve. but it is very deep and rooted in structural racism. And so there are very real things that feel so big and feel so hard to fix. But I do believe that, with people like the ones on this call, we have very real solutions. And I think most importantly, for people like Lexi and Junia, who are the youth that are really leading this effort, we can make a difference. But this is a problem that has been here for a very long time, and one that I think has very real solutions.
So for me, I tell this story sometimes about how my introduction to this work was several years ago when Trayvon Martin was killed. I was a teenager who had to learn very quickly how to organize and rally my community. And that experience has shaped every other experience that I have as it relates to violence prevention as an adult now. All of the young people that we work with too have their own personal experiences with violence. And in a weird way, I think we all do, right? Whether we are direct, we're direct, uh, we were directly involved with violence ourselves or have experienced it secondhand ways. I think in a weird way, my own experiences paired with the experiences of the students that I see in our programs around the country give us like a way to relate to each other and find common ground. All of our work at Project Unloaded is to open up conversation and to make this idea that talking about guns and talking about risk and safety doesn't need to be this like super mystified, scary thing. And I think it's heartbreaking that I had this experience as a teen, that the teens I work with are having experiences, and there is a cycle of violence that does not stop and is so pervasive to our lives. But I think there is this like warped um community that we find in that, this warped sense of safety that we find with each other. I work really closely with teens who are, like I said, system impacted, experience violence themselves. And when we're able to sit and think together about how we use our experiences to build power among ourselves and build safety, the actual safety that we want to experience with each other, I think that's been very powerful for me.
When we think about gun violence, I think oftentimes we're really like hyper focused on the survivors and people immediately affected, as we should be. And I also think that sometimes what's lost is kind of the ripple effects and the way that gun violence not only affects those directly involved, but also the friends and family of those involved, and then the way that that expands out into the broader community, and just the collective trauma that our communities experience as a result of gun violence. So, kind of one of the things that our team is thinking about is how are we building resilience, both at an individual level, but also building community resilience and providing spaces for people to heal and get the support and resources that they need. And I also think too often with gun violence too, I don't think we spend enough time kind of thinking about the like pernicious lasting effects of gun violence and an incident of gun violence on an individual and the broader community, and kind of thinking about what sort of resources and support that we can get folks immediately and then in the long term to make sure that they have the ability to get access to mental health, to community support, to mentorship, to whatever sort of resources they need to kind of to heal in the way that feels right for them.
Thank you so much, you all. And Rachel, you mentioned a great point just about how gun violence, it contributes to a collective trauma. And then you also mentioned, just resilience, especially of the community, which brings us to our next question. So, what role does trust and relationship building play when discussing gun safety with the community? And I'll start with Antaeus, followed by Almira, and then we'll close with Monique.
Trust is everything in the community. We have known that most communities about gun violence have distrust in not only the system, hospitals. So we work with trust as being as going in there, finding who is the person in contact of who the people trust the most. That's where you got to find and building that trust with that person in order to build trust outside of that. If you don't build that community trust, you can never solve the root causes of issues that we have now with gun violence. So that's something that we not only preach, teach, and intercept ourselves. We work with the different organizations. Again, we work closely with the Unity movement of how their ability to just talk and build that trust is something that most people don't have. And I think we have to give the trust for organizations like ours and other states organizations and have to help them build that trust so we can continue working together to end community trust, get community trust.
Yeah, great points. I think trust and relationship building is everything. I think in terms of like being in a hospital, historically, hospitals are perpetrators of violence. And so I think it's important for our role to be there as advocates for our patients. That way they have an experience where they felt heard and seen and understood and like their safety was priority. And so I think that is an important way to build that trust with the community and hope that kind of permeates throughout the community as well. And I think doing community events like this as well to let them know that we are in the community and we are here advocating for their safety outside of the hospital, and that we're going to be there when they are, if and like hopefully they're not, but if they do end up there, we are there to support them.
Let's say it again, authenticity. The authenticity first, to help with the speed of trust, of them, because trust is built by, um, you know, being authentic. Okay. And then listening first. Trust is also built by actively listening to what the person needs and not trying to figure that out for them, or the family figure it out for the families. And consistency. Consistency. If you're consistently engaging, consistently showing up as the same person, consistently giving supports, consistently showing empathy, consistently holding a safe space, I think that's how we work that out. Um, it's difficult though, because now, like, all of us are sort of kind of preaching to the crowd, to the choir, we know, but it's like, getting the message out that over policing communities is not what helps, that only further creates a larger divide between the community and who they even want to trust. And so when you go into the community and they're skeptical because they're over policed. And so, and culturally, historically, relationships with law enforcement in Black and Brown communities, it isn't the greatest because it wasn't built on foundation that is honorable. So that's going to continue to be an issue for us. But as long as folks like us are continuing to spread the knowledge and information that we know work and helps, I think that's the most important.
Thank you so much for that, you all. And Monique, you definitely raised a great point on, just making sure that we get the message out in unison, especially within the communities. And especially speaking knowledge and spreading knowledge because people can't do what they don't know, which is why, we're here in community today with all of our wonderful panelists who are experts in their field sharing with us, which brings us to our next question. So, how can clinicians and community partners talk about secure firearm storage in a way that feels, respectful to gun owning caregivers? I'll start with Dr. Sama, followed by Olivia, and wrapping it up with Rachel.
Yeah, this is a great question. And I think that for many years, the vast majority of clinicians have been doing this wrong, where the message was remove the firearms from the home. don't have firearms, period. And that's like where the conversation ended. And it just doesn't acknowledge the reality for many families who, and caregivers in particular, who feel that they need that firearm. And so I think you have to meet the parent where they are, respect that decision, and really take the tip of harm reduction. The opioid crisis has really used this very successfully, where they said, you know, people are going to continue to use opioids. Our counseling isn't really making a difference. How do we make sure they use it safely? Okay, we're going to give them ways to safely dispose of needles. We're going to give them Narcan. We're going to give them those tools so that even if they decide to continue to use, they're going to do it in the safest way possible. And I think we have to take that same exact approach to secure firearm storage. We're going to acknowledge that families are going to keep those firearms, but really talk about how can we do this in the safest way possible. And I think approaching those conversations with respect of those caregivers, with an understanding in particular for Black and Brown families that safety is a very real concern. And even for youth, safety may be a very real concern and a reason they decide to carry a firearm as well. And so, how are we going to do this in the safest way possible is, I think, how you approach that conversation. And doing a lot of what people have already talked about, being authentic, listening first. Not just coming at them with your instructions to, you know, secure the firearm, separate the ammunition. Yes, all of that is true, but you know, listen first, understand context, and meet families where they are. And I think that will go much better.
I'm going to take this in a bit of a different direction. Our work at Project Unloaded does not rely on a secure storage message at all. And the reason for that is because we think of what we're doing online, in person, our risk education, as primary prevention, particularly for young people who haven't made their mind up about whether or not they want to own at all. We see that like age that I mentioned earlier, 13 to 17-year-old, as a prime opportunity to get young people thinking about the ways that not owning a gun can be a safe choice too, and can be a choice that they feel confident in as well. Right? We know that young people who want to own guns and might have experience with guns feel very confidently about their experience and their want to own a gun in the future. For the young people that we're reaching who haven't made their mind up and aren't sure about what that decision will look like for them in the future, we're giving them information that makes them, one, feel confident that the decision to not own guns is one that is meaningful for them too and is safe, both for their individual home, but also for their communities. And we're also painting this picture, both online and in person, that you can live a fruitful life that doesn't include a gun, right? Gun violence, in our frame, isn't this like inevitable story. And we are working for a larger kind of generational conversation where young people do feel safe considering, you know, not owning as a viable option for feeling safety, right? I ask young people often in our programs, what makes you feel safe? And we never really get an answer that mentions guns as what makes people feel safe. Makes me think about one of the panelists who mentioned that like feeling of belonging. They often say things like community, my family, and what our work does reaches them with an opportunity to build more of that thing, that more of that community, do more of that as a way to feel safe. So when we think about what we can offer to these young people who might live in gun owning homes, it's information that builds their confidence and tools for having conversations that are rooted in fact and not fear or sensationalism.
I think I would echo a lot of what Dr. Kamal said. The reality of this country is that there are more guns than people. By some estimates, as many as 500 million firearms in the United States. And the way that we kind of approach our secure storage work is recognizing that that is the reality that we're in and thinking about, again, how we can promote safety within that reality. And people have guns for all sorts of reasons, whether it be for personal protection, recreation, etc. So when we are thinking about secure firearm storage, we try to approach this work with curiosity, with openness, with a judgment-free perspective, and to provide all types of resources. So in our community, we currently give out gun locks. We've given out like 6,000 in the last like 18 months. Um, and we hope to soon be able to give out free lock boxes as well and to remove all barriers in the access of those tools and information to promote secure storage. So barriers including price, including access, the time cost of being able to find these tools. So that means that our team, as a local government agency, is out at trick-or-treating events and back to school nights. We are providing free gun locks at libraries, at local restaurants, at doctors' offices, so that people do not have to go out of their way to get access to these life-saving resources and information. But instead, again, I said this before, the barrier is on our team as the local government agency to do everything that we can to get this these gun locks and these gun safes into the hands of the people who need it the most.
Thank you all so very much. And Rachel, that was a great point. Just, being able to promote safety in a realistic way. And Olivia, that was actually an interesting point that you mentioned. When you ask youth about safety or what makes them feel safe, you never hear guns. So that does bring us to our next question, which is youth-centered. What support would you like to see for youth as it relates to conversations around safety and secure storage? So we're going to start with our two youth reps. We're going to start with Lexi and then Junia, and we're going to close with Olivia.
So I think just to echo based off of what everybody was saying, I think Monique made a great point of authenticity. I think that oftentimes the youth is very treated with like these kitty gloves, right? Where it's like they're not part of the conversation or what do they know, right? But I think it's like one of those things where you have the perspective of leaving the world a better place. And unfortunately, the people before us have not done a lot of work in this area in terms of youth safety and having that as a priority. I think, unfortunately, the reality is that a lot of the gun violence prevention work is rooted already in intervention rather than prevention, as much as we try to do all this prevention work. And so I think with how we would like to see youth involved in this is to be creating more spaces in organizations, to be like in the front lines, to be boots in the grounds, talking to their peers, doing educational, I guess, gatherings, because a lot of it is rooted in you don't know what you don't know. And a lot of people just don't understand the fundamental of safe storage, don't understand the fundamental, what even encompasses violence, right? Especially when we're talking about the reality of guns. And like Olivia was saying, a lot of them are becoming like future citizens, right, of having this immense responsibility of deciding whether or not they want to bear arms and basically utilize their Second Amendment. And so in order for us to have them be educated in whether or not they want to engage in this, right, I think that we have to have them be part of this conversation now and in the early stages. And so I think creating more organizations that are supported by the larger as well, that gives them the spaces, the roundabout tables, really being in schools. I know that's a little difficult with all the red tape, but really trying to create spaces in these community gathering, and as other leaders who have been doing this work for many years, to really encompass them and include them, because I think that they're just willing to utilize their voice, but a lot of them just don't know how to or where to utilize it.
I agree so completely with what Lexi has mentioned. I feel like as a young person who has been involved with advocacy since my freshman year of high school, I've often felt overlooked or dismissed in spaces that are often adult dominated. So I feel like young people need spaces where they feel like their contributions are valued, and that their opinions aren't being treated or thrown off as naive or fear-based. And I think that can happen through more youth organizations that are focused on organizing and mobilizing students around gun violence prevention. But I think that can also happen by meeting young people where they're at. So some of the most powerful conversations that I've had with adult mentors and advocates are conversations that I know have some of my needs and safety needs centered. So for example, being able to find times to talk with young people and have those kinds of dialogues and conversations that fit around young people's schedules. Like for example, whenever I am communicating with an adult on like a time to meet to discuss an initiative or a project. I always communicate my school schedule, what I have happening with my education, and having that accommodated makes me automatically feel so much more safe and valued. And on top of that, being able to also meet young people where they're at in terms of like community centers, libraries, fairs, events, pride, are all great ways to contact young people in a way that is authentic to them, and where they're automatically in a space where they feel that they are being seen and heard.
Yeah, I would definitely echo that meeting young people where they are point. That's something that's central to everything that we do. Um, at Project Unloaded, we hear exactly what Junia and Lexi have said before, that young people, when they initially work with us, they often feel like, I have been framed as like a perpetrator of violence, but I can't be the solution. And it's always exciting to go on a journey with them that says, no, you absolutely are the solution. We need you here. We want you here. We will do everything in our power to make the space for you to feel like you can have this conversation in a productive way for you. And some of what that looks like is investment in those spaces that are meaningful for young people. One of the ways that we do that is through social media. A lot of our work happens online through digital campaigns and native social media posts, as well as working with influencers. I think oftentimes social media and young people are trivialized for lots of different reasons, but both are so powerful, right? And I think we've really found a stride in finding creators online who want to have a conversation with their audience, who already have trust built in with teens who want to learn from them, and then giving them the meaningful conversation or meaningful way to have this conversation about safety online. I also think there needs to be a like serious investment in youth ideas and bringing them to life with adult money, right? So one of the things that we recently did, we every year in Chicago we host a pitch competition for young people to create their own social media campaigns and then pitch them. This year we are bringing one of those student campaigns from this past summer to life. It hinges on Chicago lingo. If anyone else is in Chicago, you've probably heard the term goofy before. And these are kids who made this campaign about how it's goofy to just like believe everything you hear. It's called Goofy's Got Guns. It's coming out soon. It's entirely teen created, teen thought, and it's brilliant, right? It speaks their language and it effectively so. And I think we need to do more of that, centering accommodating and investment in order to make sure that youth are seen and protected and platformed in this space.
Thank you all. That was wonderful. I do want to popcorn that to Antaeus. I know you work with youth. Did you have anything to add to that question?
Uh, yes, safe storage to youth and just the youth in general. We realize what youth want the most is resources. Go back to Olivia talking about social media. Social media is such a big thing that we know people want to make either they're making very short videos. We connect with that. But our safe storage method is not to talk about teens. It's really to target to adults. Those adults that own firearms in their home is their gated is their child best accessory. And that reason means because if we tell the adult, hey, this is safe storage, maybe they can tell their kid, this is not a toy. This is actually a means of protection, hunting, recreational. It can be used to kill someone or you harm yourself or someone. I think those conversations we like to do and open up. And that comes from our life-saving practice retreats that we kind of combat our CPR training in, TBI information, gunshots, and bring our youth in to talk about how can we change the culture of accepting gun violence. So we put all that in a nutshell, and we understanding that doing that in those retreats and having them for free and having people come out and just other influencers or companies that might have an interest in helping the youth, those are what we can tackle when it comes to talking about safe storage and gun violence to solve all the root causes. Because there is too many root causes when it comes to gun violence. We're talking about if And not even that, we also talk to people who have been out of gangs too, as well, because we also know when they lose friends, they want to go back. So it's a target system that you just can't miss when it comes to just youth. It's you, people that are youth, people before youth. I mean, in their early 10, 11-year age before they reach teenagers. And then you have people that have been out of gangs when they're like 26, they got kids, and then they fell back into the trap. And then that creates another generation of violence. So we talk about gun safety and locks, it comes all into our retreats that we like to do.
Thank you so much, Antaeus, for that. And you mentioned a good point that I just like to highlight that messaging to youth on how to change the culture of accepting gun violence. That's a nice think piece, which transitions us to our last question. It's our collective close. So as we do begin to, wrap up this panel, I do want us to again think collectively. So this is essentially our call to action. How can we work together across different sectors to promote secure storage in our communities? So I'll start with Rachel, and then Antaeus, and then Dr. Sama.
So our team in a local government agency thinks of secure storage as just one piece to a broader way to reduce, address, and prevent gun violence. And that strategy is really focused on investment in addressing the root causes and the drivers of gun violence and thinking about how we can take a public health approach and instead invest in protective factors, and lean into some of those protective factors as well. So on the secure storage lens in particular, we're thinking about trying to normalize conversations about asking if people have firearms, how they're securely stored, and trying to remove some of that stigma that's so pervasive in certain communities about gun ownership. And because if you're not asking, then you don't know the answer. So we are providing trainings. We're working with community partners and really trying to make sure that parents and others feel comfortable asking how those guns are stored. Just to reiterate what I've said, and I think a lot of others have said as well, again, meeting people where they are, whether that is physically, emotionally, intellectually, and really kind of making that investment and doing that work, to make it easier for them to get access to the information and resources they need. And then lastly, I would say we recognize as government that we are not always the right messenger for this information. So thinking about how we can rely on some of the trusted messengers in our community, whether that is faith leaders, whether that is physicians, whether that is community leaders, and young people themselves to kind of spread the message, and utilize them to share information and resources that can help people.
So what Rachel, go to piggyback what Rachel said in last discussion. We have actually found out how to handle our gun locks in an efficient way, and that is through gas stations, vape stores. We realized that during our conversations with people, some people might not want to go into a police station because they already the stigma of we're going to take your guns anyway, and that has such been a direct message for so long. So when we like to give our gun locks, we like to give them out. And actually we distribute 1,700 gun locks that way, which was amazing in a matter of 5 months. And we realized if we brought this away in more gas stations, and then we also attach a card to let people know about our programs. That way they can have the curiosity to come in because I believe we have switched so much into telling people they should lock their guns up that they're afraid to come into those conversations. So that's the one thing we realize we like to do. We like to make sure they come into those conversations by offering free gun locks in different areas and saying you should come take our life-saving practice program. And we just we that's the only thing we can think about when it comes to safe storage. That's just how we have realized that's the way of the communication when it comes to safe storage.
I would echo a lot of what Rachel and Antaeus shared and say that as a physician, Elmira mentioned this before, but we are in some ways trusted, but in other ways, not. And so I think if you come at it with just saying you should lock up your firearms with no relationship building, with no trust building, with no listening first, that's not going to go well. And I doubt that that caregiver or that youth is going to take those recommendations. And so I think starting from a place of authenticity, as Monique said, and really working to build the relationship with families, being consistent with your messaging and normalizing it. We talk about a lot of hard things in healthcare. We talk about substance use, we talk about sexual health. Those can be uncomfortable conversations, but they're important to have, as is this one. So just getting over your own personal discomfort with having the conversation and making it something that feels natural and normal to talk about, I think is important. And then to what was said before, really getting out in the community. If I relied solely on my emergency department visits as the one time that youth and families are going to get secure storage devices, so many people would never get them, right? So you need to go out into where people actually are, into libraries, into schools, into youth centers. And that's where we should be really distributing devices. And then the last thing I'll say is, we often rely on cable gun locks. They're the most affordable option. And so I think when we're giving out devices in bulk, that's what we lean on, but they're not actually what I think families prefer. And so if you are an institution or an organization with more resources, considering getting devices that people prefer, like biometric devices or lock boxes or gun safes, we've seen that families really appreciate those options to have for the different storage devices.
Thank you all so much. I would love to popcorn into Almira to share your thoughts. You do work with the Chicago Medicine, and I know you're a social worker. Anything to add?
Yeah, I mean, I think these are all amazing ideas. I think the gas station, the vape stores are great. Whenever we have access to gun locks, we do distribute them within the hospital, and have them as accessible as we can, for patients and families. Our work at the hospital is very reactionary, so anything that can be proactive, I mean, is amazing and wonderful. We're there to help after the fact, and hopefully before, if people are there for, other things as well. But I think any way that we can, keep youth at the forefront and hear from them directly is amazing, and continuing to have those conversations with youth and understanding really, like, what are they thinking in terms of gun safety, if there are thoughts around that. Are there youth that think that they do feel safe with a gun and without, and what does that look like, and what does that mean for them, and what does that mean for their families as well? I think just understanding how people are thinking about access to guns and having them in their homes can help us understand what they need, in terms of gun safety. But yeah, I think us having access to them in the hospitals is great. We have connections to CVI programs, community violence intervention programs, Claration, Think Outside the Block, Project Hood. They're all rooted in the communities. So the more that they have access to gun locks and safety boxes, the better, because then they can actually distribute them within the communities, hopefully before they get to us in the hospital.
Thank you so much. And lastly, we're just going to popcorn it to Monique to share final thoughts on our last question.
So all of those are great ideas, and you guys are doing some awesome work. I just want to commend you for that. There's some awesome things going on in the community for our youth, so that makes me smile. I would say collective promotion of the secure storage, like maybe messaging campaigns. We need to normalize it more, make it like a part of, like, I don't know, like how they have the vape commercials and campaigns. I think we could do the same for the locks and the secure storage.
Sounds good. I would love to just pivot to the youth. You don't have to answer that specific question, but just wondering just your thoughts in general on, just working together as a community to, promote safety and secure storage. I know, Junia, you spoke a lot about, including youth in these conversations, having them at the table. Lexi, you talked about inclusion. So I would love for you all to just, give us some more food for thought, especially from your perspective. We'll start with Junia and then Lexi.
Yeah, so I would say like my top piece of piece of like information that I'd love for everybody to consider when centering youth perspectives is genuinely I think I already mentioned this, but meeting people with where they're at. So whether that be time wise, like I mentioned earlier, physically, or even like intellectually, having those conversations where young people can completely understand and completely have that agency to participate and be involved. So often I find my peers are turned away by these kinds of discussions where it feels like you have to know everything in order to be able to have an active role in it. So being able to communicate that it's okay to be learning and to speak and to acknowledge that as long as young people are putting their like their best interests and their best foot forward in these conversations, that they still have the right to be participatory in these kinds of spaces. And I think along with that is being able, I think the lingo is such an important thing that I hear people mention. So whenever I have conversations with these with other young people, being able to include something that I know will make them feel more in community or more comfortable, and being able to like include those like little pieces of small talk as well will really center young people in any sort of conversation, dialogue, discussion that all of y'all are having.
Yeah, so I think my last tidbit is kind of centered around, I think it's really hard sometimes as youth advocates to be kind of the only people having these conversations. I know in the recent years since getting involved in GVP, it's kind of sometimes hard to be the only one leading the conversation as much as it's great and it's amazing. I think something I've learned is that sometimes we have to kind of table the statistics and the verbiage and all of those things and just really the power of storytelling, right? Storytelling is such a useful, and impactful tool, especially with the youth, because you can give them all these statistics and you can tell them this is happening in your community, but until they hear from someone they know, until it's really in your face kind of moment, does it really click? And I think that, as we're talking about youth, I think sometimes they're really underestimated in their power of their voices. And so I think it's really crucial, especially given the political and social climate that we're in, to really create spaces for them to have the ability to learn what it is to be an advocate. I think we all have this distorted idea that we have to be like at the steps of like the Capitol in your cities, or have to be calling your representatives, which is all great and you should be doing that, but it's not realistic, and again doesn't meet the youth where they're at. And so it's really important that as people who are older, who have more experience and have been in this fight for so long, or even in a short term, to teach the youth what is their resources, how can they be advocates, how can they be a part of the conversation. And I think with social media, I think also dictating the conversation of performative activism is also can be harmful, right? What is the purpose of this conversation? What are we trying to really send as a message, and standing firm in that message? I think it's something that social media can be a tool, but I think we saw it a lot during 2020. Just putting a colored box doesn't really, get a message of like what you should be doing in your communities, or conversations to be having even within your own family or friends. So I think it's something that we really need to lift the youth, because a lot of the times the youth that are really trying to have these conversations are the only ones around having these conversations. And so being uplifted, being supported, seen and heard, as we have discussed, I think it's really important. But again, talking about what can you do that's in your capability as the youth, whether you don't drive, whether you don't have the resources to do X, Y, and Z. I think it's really important just utilizing storytelling first and foremost, but also being able to tell them really what being an advocate is. And it isn't this, out of the world, you have to do these grand campaigns or be part of grand movements. It can really start in your own communities and within your own homes at times. So I think that that's really important, and where we should also place a lot of focus on, especially in this time where the youth wants to be engaged, the youth wants to be mobilized. And I think we're seeing such a big change in that climate of seeing just the youth being angry and being rightfully angry, not just for safety in terms of gun violence, but in safety of everyone and human rights. And so I think it's really, really important for us as leaders and pioneers and with organization, with resources to really mobilize that, especially today.
Thank you so much. That was great. And thank you that we were able to close with both of the youth voices of Lexi and Junia. We, are all professionals and it's great to hear our perspectives, but we want to hear from you all, the youth, which is why we're here today to center your voices. So thank you all so much. I just wanted to pull a few things out from what you both said, Junia. I heard you saying, the youth having the right to be participatory, that cultural inclusion when it comes to language and other things. Lexi, I heard you mention about, the importance of narrative and storytelling, uplifting, empowering youth voices, and intentional messaging, with advocacy as well. So thank you all for that. And I just want to, wow, like that, those are all powerful reflections. I'm blown away. Um, we will now move into question and answer. I don't believe we have too many questions and answers, but I will transition it over to my colleague, Emily. And if we have any questions, she'll go ahead and read them out loud.
Yes, thank you to our two youth. That was very powerful. Going off of what the youth said, Monique, how do we take what the youth said to reach disadvantaged youth and reach those root causes and those social drivers? What does it look like to reach youth who are food insecure, who are housing insecure, who come from places of positions of poverty, and taking what our youth just said and applying it to those families?
So I think the first thing is to be non-biased and non-judgmental in our care. So that's a form of the trauma-informed care, like understanding the communities that you serve in, understanding the demographic, being familiar with their needs, and being connected and rooted in those needs, and focused on that rather than focused on any outside or internal thing that I might think myself. And sometimes you'll find that they have a lot of pride and they don't want what you got to give them. So again, it's that relationship building and that authenticity where, because, trauma informed care tells us that sometimes people like to leverage basic needs in our community. We see people do it all the time. We see teachers do it. We see politicians do it, leverage basic needs in return for something, right? So as long as you're being consistent in giving that service, no matter what, I think that'll help us reach in like you said, like I was saying, relationship building, so that because they gotta trust you to be able to come and say, hey, hey, Karma, I'm really having this, I couldn't wash my clothes or I couldn't do this thing. They're not going to do that with somebody that they're not connected with. And like Alexi said, that they don't feel heard or seen with, whether they know it, are being, not being authentic with them. The other thing is the cherry picking. We have to be comfortable with the uncomfortable. I see lots of executive directors and, program managers, not to throw shade, but we can't go to Sunday school and pick our participants. Like we can't, because those are polished pebbles. We need to be out in the street with the child that's, I ran across that's maybe just standing selling candy bars in front of the gas station. That's who we probably need to target. And that makes us uncomfortable though, right? Because now it's like, I don't know, but that's really, we need to quit cherry picking and we need to hold space non-judgmentally. We need to be consistent. We need to be authentic. And we need to keep our service rooted in what they want and what they need, according to them, not us.
Thank you, Monique. I know you're another person who could talk about this for hours. Olivia, piggybacking off of that, how do you community organize youth from those disadvantaged positions and get them to things like peer support specialists?
So our work isn't solitary and existing in a silo. I think that's the biggest part of how we're able to reach so many teams and work in many communities around the country and in Chicago. This is work that is rooted in partnership. When I talk about students and programming, this happens in collaboration with lots of organizations across the country that teens already know, they trust, they get resources from already, right? Our piece of the pie is risk education and opening up a conversation, and we work alongside organizations that are doing a little bit more direct service. We pay our students, right, for their time working with us, which is so important. Going back to that piece about investing in their time, right? This is work that they do and they should be compensated for it, right? And we partner with folks who are able to do that for them or provide other services. When we work with disadvantaged youth, and like I mentioned, almost all of the teens that we work with have personal relationships to gun violence. They themselves have been shot. They know people who have, they know people who carry, right? And our job isn't to come and say, you and your family and the people in the community you love are bad, but rather, here's a resource for how to navigate safety in a different way. And I think hinging on our partnerships is a big is central to how we get that done. And it wouldn't be possible if we didn't have strong partners who are already doing a little bit more of this direct service providing and partnering with direct service providers and a little bit more of an intentional like CVI uh, organization. I think that's how we get them connected and keep them connected. I think it's one thing to make contact one time, but it's also important to kind of support their trajectory as they grow as young people in their communities. And
Thank you, Olivia. Thank you. Um, Bouncing off of that, Dr. Kamal, when you do see um, in the emergency room someone who was shot, a youth who was shot, or a youth who accidentally shot themselves, there was an accident. What do you need from social service providers? What do you need from youth peer support specialists?
So we know that after an injury like this, that there's immediate needs and then there are long-term needs. And kind of speaking to what Olivia just said about long-term trajectory, it's important that these youth are linked into some connection that is more long-term than just, I'm going to give you a referral after this visit and hope that you have the follow-up that you need. And so we have a hospital-based violence intervention program. Elmira is obviously part of the one at University of Chicago as well. And I think about these programs as ones that walk alongside families as they navigate what is a changing trajectory over time, where sometimes families we meet with in the beginning, they actually don't want any help. They are still processing what they have gone through. And sometimes they want a lot of help in the beginning, and we can give them referrals to different programs like victims and help them with things like victims of crime compensation. The event may have led to them becoming housing insecure, and we can help them with that. Or maybe there is food insecurity, we can help them with that. And then, like I said, those things change over time. And so I think the importance of programs like that is, or community organizations that walk with youth and families over time, is that they continue to meet the needs for as long as families need that help. And so if it's okay, Emily, I'll pass it to Elmira because she does more of this work on the front line and can speak to that in more detail.
That's who I was going to bounce it to. Thank you.
Sorry. Okay. Yeah. Thank you for offering that. I think that yes, like we have access to a lot more of those social services on the ground in the communities as a hospital-based like violence intervention program. And so not only are we seeing them right when they come in and creating that trust right when they enter the emergency room, but we're there while they're inpatient. And especially for our youth, we follow them after they discharge as well. And so that includes checking in with them weekly, bi-weekly, whatever they're needing, and ensuring that they are getting the things that they need. And part of that too is making referrals for our youth specifically. We have Healing Hurt People as one of our connections. Our React program does therapy. And then any of our community violence intervention partners, we will continue to work with them to ensure that they have access to the CVC, the Crime Victim Compensation Application, as well as emergency supplemental funds for like housing relocation in the case of being targeted. And then anything that our city has essentially. Sometimes we are constrained by the resources that the city and the state have. Obviously housing is really hard, but we try our best, and we try to get access to as many resources as we can. We do have access to like Aldi cards at U Chicago, so people that are food insecure, we're able to hand out Aldi cards, gift cards, and then as well as like food vouchers at the hospital for families that are there for a long time and don't always have access to getting food in that way.
Thank you, Elmira.
Yeah.
I have a follow-up question. We had a question in the box. How do you navigate talking about legality of ownership when talking to teens about safe firearm storage? Is there ever a conversation piece about using or keeping firearms correctly? We want to practice harm reduction, as Antaea's program does with Stop the Bleed and CPR, and talking to youth. But there are also situations where a youth will present in the ER, and there's a situation where social work does have to step in, where state's attorney's office does have to step in. What are your perspectives on that situation? How do you handle that? And Rachel, please feel free to jump in as well.
Was that directed to me? I just want to.
Yeah, directed to you,
Okay.
directed to Rachel,
Okay.
even directed to our youth as well.
Yeah. Yeah, I mean, in the cases of like DCFS having to step in, we are still there, connecting with our youth daily and trying to help them navigate that, because that can be a scary thing too. I mean, we've had situations where mom may not have custody of the child that's in the hospital, and situations occur, but we try to advocate to make sure that mom can at least visit during that time. We're in contact with the DCFS coordinator a lot of times to ensure that our patient is getting the care that they need and is going to be going to a safe place, or a place that is going to help foster their own growth and mental health and things of that nature. So we're there the whole time, and oftentimes are kind of the point person within like the DCFS cases. We're not the ones that call DCFS. Social work usually does that, but we work in tandem with everybody. So yeah, we do our best to just try to be there as advocates for our patients and ensure that they are getting the care that they need.
Elmira, thank you. Rachel, are you still with us?
Yeah, I'm here. I can add on a little bit to that. I will say that when we are out in the community, one of, like I mentioned before, kind of one of the core principles of the way we think about and talk about secure firearm storage is really from like a no questions asked judgment free zone. So that is not a question we ask. Like when we are at like a back to school fair and someone asks if they can have 15 gun locks, I don't say like, sure, all of those guns legally registered. Do you have a FOID card? Like that's and we kind of view that as outside of our purview and really try to take that harm reduction approach, right? Of let's get them the resources that they have or that they may need, and not ask those questions. And especially from in a government entity like the state's attorney's office, which has historically caused a lot of harm in different communities, I think we're really mindful of being really intentional about building trust and not using gun violence prevention and violence prevention work as a means to kind of pull more people into the criminal legal system. To us, that's fundamentally counterproductive to our approach to violence prevention.
Thank you, Rachel. I think that is an excellent way to elevate one of our calls to action, is that we just saw that there's an organization like Antaeus where they are doing that boots on the ground work with youth. We have the social work perspective of how they handle that in the hospital setting, and then how government officials, the state's attorney, law enforcement also handle that. And so we need to elevate that all of these entities can work together. We are a united force. And I believe that's the most important thing that we need to, again, elevate and bring to the table and shine a light on. So I want to thank all of our panelists for joining today. I thank everyone for your participation in this webinar. Again, we cannot do it alone. We will have the recording available for those who wish to have it. We want to produce those calls to action and consolidate them in an email to you all. And our work is not going to end here. We have some future plans for bringing this united front together.
Thank you, Emily. I appreciate
And
it.
with that, we hope you all have a wonderful rest of your day, wonderful evening, and we bid you farewell. Thank you all so very much.
Thanks, everybody.
Thank you.
Thank
Have
you
a good
all.
day.
Thank you.
Thank you
Take
so
care.
much.